Fluid, local gender expansive services. Individuals who experience distress and discomfort because of the contradiction in their biological sex and the gender with which they identify are experiencing gender dysphoria or GD. The term fluid in gender diversity refers to a more flexible range of gender expression not limited by specific behaviors or interests. Fluid's focus will be those children in early and middle stages of adolescence, ages 11 to 17, where they experience the onset of puberty and may have the most difficulty locating help and counseling in medical services. The location of this program will be a South Texas metropolitan area with a population ranging from 2 to 6 million. Fluid, Local Gender Expansive Services, is affiliated with the Human Rights Campaign, or HRC, which was founded in 1980 and currently represents more than 1.5 million members and supporters in the United States. The goal of Fluid is to provide support for families as they go through the complex decisions involved in the care of adolescents with GD. The program will provide an assessment of psychosocial needs, counseling, and medical support to help with issues such as social acceptance, anxiety and depression, and gender assignment. Clients will be connected with resources and counseling, as well as physicians who focus specifically on these sensitive issues. Considerations for psychosocial development according to stage theory, along with physical development during adolescence, will be the focus of Fluid. The sole purpose will be to assist GD adolescents during a difficult transition. The HRC has advocated on behalf of the lesbian, gay, bisexual, transgender, and questioning or LGBTQ community since 1980, but they have recently allied with other organizations to protect transgender rights and help to end transphobia, as well as protect them from hate crimes. They are affiliated with physicians all across the U.S. who have a focus on the special issues faced by the LGBTQ community. Historically, transgender youth have proven to be at risk for anxiety, depression, self-harm, suicidal ideation, psychiatric hospitalizations, homelessness, exploitation, and abuse. Unfortunately, there is a substantial service gap in the treatment of GD due to complex issues surrounding appropriate age of intervention, level of intervention, and parental consent. Genotypic female adolescents experiencing GD often present early on through a refusal to wear female swimsuits, breast binding, and decompensation at the onset of menstruation. Genotypic male adolescents experience their highest levels of distress during this stage of development due to skeletal changes, changes in voice, and the appearance of the Adam's apple. Recent research and clinical examples have proven similar programs providing mental health assessment and treatment in conjunction with medical efforts have been successful in alleviating the symptoms of GD. The first step in the Fluid program involves a conversation with a clinical social worker regarding the specific gender issues facing the client and their family. The clients are connected with a Fluid-affiliated therapist who is familiar with adolescent gender issues for initial therapy, which is recommended to last at least 3 months before proceeding with further evaluation. Second is consultation with Fluid's counselors and qualified psychiatric team about the child's gender nonconformity and mental health needs. A meeting with a psychologist for specialized gender-related evaluation and to address other issues such as anxiety and depression will allow the medical team to gain a full understanding of the child's situation. The final step, if required, is to meet with a pediatric endocrinologist to plan a course of treatment. As outlined in the APA Ethical Principles and Code of Conduct, providers associated with Fluid will obtain informed consent for therapy from the client and legal guardians. Because this program will be instituted and delivered in South Texas, state law allowing children who are at risk for suicide or abuse to seek treatment can apply. The first 6 months of the Fluid program entails establishing a central location as the base for initial evaluation and referral. During this time, a network of specialized psychologists and physicians will be constructed as the working team. Within the next 6 months, a web and social media presence will be formed to promote Fluid within the community. The goal is to have Fluid begin providing services within the first year and expand the network of providers in the following 2 to 3 years as the program continues to grow. A hotline for emergency services will direct clients with critical needs to the nearest hospital affiliate, but most services will be available through appointments made Monday through Friday. The cost will be commensurate with other mental health interventions, and the impact to the community will be minimal considering these clients may already be actively seeking counseling. The cost benefit to the community is a reduction in adolescent mortality rates as a result of gender dysphoria. There is a stigma surrounding transgender, and many who experience GD refuse to come forward and admit their discomfort or conflicting feelings. Anxiety, depression, and suicide are common among adolescents who suffer from GD. It is expected this program will have a twofold effect. 1, the program will see an exponential growth in clients seeking treatment for GD, and 2, the interdisciplinary approach through assessment, counseling, and medical treatment will improve the quality of life and health of those adolescents who might otherwise suffer as a result of limited or no intervention.